Hi, my name's Sally Mitchell. I am a technician at Austin Health. Today, I thought I would tell you a little about the Medication Education Technician project we ran at the Surgery Centre at Austin. If you have any questions, if I can ask you to pop them in the chat function, and I'll try and address them at the end of the presentation. Also, this presentation will be recorded if anyone wishes to listen to it later. What is a MEdTech, or a medication education technician? We define the MEdTech role as having 2 additional duties on top of the regular dispensing and supply role that our current satellite technicians have. These were to discuss the patient's discharge script with them directly, ascertaining those items that they may already have at home, those that they didn't need now but may want to get later from a local pharmacy if needed, and those that we would supply. Then, once the script had been completed, going back and educating the patient on those medications that had been prescribed, regardless of the supply of them. Why choose a surgery centre? Austin Health has 3 campuses: Austin Hospital, Heidelberg Repatriation Hospital, and the Royal Talbot Rehabilitation Campus. We chose to trial a MEdTech role at the Surgery Centre at the Repat campus. The Surgery Centre is where the majority of elective surgeries are completed at Austin Health. The ward has 32 overnight beds and has a day satellite ward with 21 chairs that are used for day cases. Repat also gets a lot of post-surgical patients transferred across from the Austin if there are no complications during their surgeries. The typical types of surgeries done are cataracts, bariatric surgery, tonsils, adenoids, hip and knee replacements, and that sort of thing. Patient turnover is quite high in the surgery centre. Some patients are in for a day, others can be an overnight stay or even a few days. The surgery centre was chosen mostly for the types of medication that are prescribed on discharge. The medications are predictable and routine, making the education process for the technician straightforward. It also meant that we could narrow down the classes of medications needing training in. We currently have 2.5 full-time pharmacists with an average of 14 overnight staying patients discharging per day. This number can vary significantly between 4 on a Monday to up to 24 by Friday. It is important to supply the discharge medications in a timely manner, as 50 to 70 patients pass through the centre each day. Why introduce a MEdTech? Bringing a MEdTech to assist with the discharge process in TSC allowed the pharmacist to focus more on the clinical jobs that often get put aside until the discharges are done, and to spend adequate time on the more complex discharges. For patients being admitted overnight, the pharmacists are required to obtain an accurate medication history and ensure their medication history is correct, allowing for proper supply to the ward post-surgery. This project allowed them to see more of those patients. They were also able then to prioritise clinical duties, knowing that discharges were still getting out in a timely manner. When looking at how a MEdTech could help in the discharge process, we looked at how the current workflow looked. A typical workflow for discharges in TSC are: the patient is confirmed by all members of the care team, so OT, doctors, physio, and obviously pharmacy. This information is communicated via the whiteboard at the nurse's station. They use a dot system with each team having their own column. Red, patient's not going, script hasn't been done, that sort of thing. Yellow is a query, so patient's possibly going home, or if it's pharmacy's column, it means that we're working on their prescription. And green, the patient's good to go from a pharmacy perspective. Script's been done, the patient's been educated, everything's good to go, the patient can now go home. The doctor then prints out the prescription with the relevant discharge items only. We only prescribe and write prescriptions for discharge medications. They don't write scripts for regular medications. The pharmacist then reviews the patient's notes, checking to ensure all items on the script are clinically correct and appropriate for the patient. The pharmacist talks to the patient about what the doctor has prescribed, checks to see if the patient has any items like paracetamol or laxatives at home. If not, do they want pharmacy to supply, or do they want to buy locally if or when they need them? The script is then prepared. The pharmacist returns and educates the patient on items prescribed and reiterates what hasn't been supplied and where to get them from if they need them at a later date. There are a number of areas in this workflow that a MEdTech can assist with. Once the patient has been cleared for discharge and the pharmacist has reviewed the prescription, the MEdTech can then assist with talking to the patients about what has been prescribed and what is needed. The MEdTech can then also prepare the script for the pharmacist to check. Once checked and the items are within the scope, the MEdTech can then educate the patient on those items and can also reiterate what has been supplied and what hasn't been supplied and where to get them from if needed. To ensure the technician, myself in this case, is comfortable and competent, an intense and comprehensive training program was designed to create a credentialed MEdTech. As it was the first time a training package had been created for this type of role, a number of staff, both pharmacists and technicians, were recruited to assist with content and the look of the program. A brief overview of what we came up with is this. We had 3 distinct training phases: observing a pharmacist, practice with direct pharmacist supervision, and practice with indirect pharmacist supervision. This combined with 4 training modules. So introduction to a clinical setting, effective communication, medication knowledge, and surgical procedures. The training modules were created to ensure the technician had all the information they needed to feel comfortable in a clinical setting and talking to patients, especially as this is an area that a lot of us don't have exposure to normally. Therefore, the effective communication module is extremely beneficial. Before visiting the ward, I needed to complete the introduction to a clinical setting and the communication modules. Introduction to a clinical setting was a hands-on tour of the surgery centre with the pharmacist. There were introductions to relevant nursing staff, an explanation of the whiteboard, where the doctor's office was, and an explanation of the setup of the beds, the chairs, the rooms. The communication module was completed by watching a number of video scenarios of good and bad communication and answering some questions about these videos. Then I was ready to start observing the pharmacist, both the interaction before preparing a script and the education of the patient once the script was ready. This gave me a chance to see how the pharmacist conducted a discharge, the introductions, the positioning of themselves when talking to patients, engaging family members, and how they ensured that the patient understood the information they were giving them. Once the first medication module had been completed, I then started doing some simulated patient encounters to get into the rhythm of talking to patients. Once the pharmacist was satisfied that I would be able to communicate effectively with patients, I was then able to start practicing with direct pharmacist supervision. This often meant that I would begin the education session with the medications from the completed medication module, and the pharmacist would then cover the other items. As each medication module was competently completed, we added more medications to my repertoire until all medication modules were completed. This was a slow and steady way of building up my confidence, talking to patients and remembering the information on each of the medications. I found it was a great way to start the rhythm. There was a number of simulated patient encounters that I needed to complete once all training modules had been completed before I was deemed competent to practice with indirect supervision. At the end of the program, I was able to educate patients at the bedside without a pharmacist directly observing this interaction. As part of the process for the MEdTech, I had to document all questions asked by the patient and the answers that I gave. This was reviewed by the supervising pharmacist on the day of discharge. This informed a great learning tool for myself as we would discuss how each discharge went, if there was any concerns I had, what went well, what didn't go well, which was then able to be brought into other discharges down the track. The list of medications chosen for the MEdTech role were based on the most commonly prescribed discharge medications. We started with analgesia as this was the bulk of the surgery centre's dispensing. We covered medications such as tramadol, oxycodone, tarjan, paracetamol, and some of the NSAIDs. Laxatives was the next module covered as they go hand in hand with opioids. Then we looked at antiemetics, antibiotics, and some miscellaneous items such as flow sinus rinse and Uril. These modules were in depth but worded in a way that was easily understood. Here's just a sample of one of the laxative medications. As you can see, the types of type of laxative is listed with the drug name. It then goes into the class, how it works, what the usual adult dosing is. For some medications, such as pain relief and antibiotics, child dosing was also. We then looked at its role in therapy, how it would help with the symptoms. We then had some basic informational practice points about the medication as well. We then covered what information the patients needed to know about what the medication's called, what dose they are to take, any side effects that they need to be aware of, and any other sort of little relevant information pieces about the medication. We also looked at some of the procedures that we do in the surgery centre. By doing that, we covered things like what the surgery was for, some things that the patient might experience after the surgery. The anatomy of the procedure was explored in some of the procedural modules. The procedural modules are purely for reference and to give an understanding of why certain medications were used post-surgery and a bit of an idea of how patients might be feeling. Once all the modules and all supervision competencies were completed, I was now able to comfortably educate patients on their discharge medications. Educating those first few patients was terrifying, but I knew I'd done the training and I'd had great support from all the pharmacists. The first few solo patients, I made sure I ran through the discharge with the pharmacist before visiting each patient. So I had it clear in my head what information I needed to get across and was equipped with a checklist to ensure I covered everything. I also knew that if I had any questions, I could approach any of the pharmacists for help. When introducing myself, it was important that I let the patients know that I was a technician and asked if they were happy for me to explain their discharge medication. The patients I encountered were lovely. On a couple of occasions, questions popped up which were beyond my scope, but the patients understood that I needed to get clarification from the pharmacist, or the pharmacist would come and chat to the patient themselves about the query. It was very much about being truthful and not making up information, knowing what my limits were, and that as long as I followed up on the things I couldn't answer, patients were still happy. There are always interesting characters that you get to speak to. Pharmacists, I'm sure, can tell you stories about the patients they've had to see. The elderly were easily distracted with stories, and so I found I had to redirect their focus back to the medication. Also, as most people were prescribed pain relief, they were also prescribed laxatives to assist with side effects. So there was a lot of discussion about bowel movements, which is all part of it, but sometimes patients would share a little too much information. As part of the study, 200 patients were phoned the day after discharge. 100 of those patients were the ones I educated and 100 were educated by pharmacists. They were then asked questions about their experience on discharge. Below is a sample of 2 of the questions the patients were asked. How easy was it to follow the education provided? MEdTech educated patients, 97% reported very easy. Compared to a pharmacist educated patients, only 86% reported very easy. And how confident are you with knowing how to take your discharge medicines? MEdTech educated patients, 96% reported completely confident. This is just a sample of 2. Yes, it is the results of 1 technician versus at least 3 different pharmacists, but I think it is a positive result for us technicians. So with the right education, the right training, we can offer good patient education. All up, including the training, the study and post-study, it is estimated that I saw over 250 patients, saving the pharmacist an easy 13.5 hours of their time. So all up, if you think about it, you educate the right technician, the pharmacists have got so much more time to be able to doing all the clinical stuff that they need to be doing. From a departmental perspective, this project has allowed the pharmacists more freedom to focus on the clinical jobs that they are required to do. It has also given them scope to look at other areas that they can also service in the future, like the pre-admission clinic. Having done the project, it has given me a newfound confidence in my ability as a technician. I can now comfortably talk to patients about their discharge medications and understand more about what I'm dispensing. It has also given me a newfound love for my job. There is more that I can do as a technician than just type a script and stick a label on a box. I enjoy helping people and great satisfaction out of knowing I can help patients understand how to manage their medications post-discharge. It is a very rewarding role. Also knowing I can help alleviate some of the workload stress from the pharmacist is very satisfying. Just to finish up, I have to give a big thank you to Brett Anderson for initiating the TSC project and allowing me to be involved. Also to all the other pharmacists I've worked with over the years who have encouraged me to continue looking outside the box. For further information, feel free to email myself or Brett. We're happy to share the information on the project and what training I did, the education modules, that sort of thing. Don't be scared to speak up. If you've got an idea of how this could work in your department, speak to your pharmacists. I'm sure they would be more than happy to have you guys on board. Thank you for listening.